Vaccinations and Parasite Control. 1. Vaccination Programs. A. Introduction. 1. Vaccinations are medications that protect against a specific disease. They are available for a number of diseases that affect swine. 2. Vaccination programs need to be tailored to each operation and should be developed in consultation with a veterinarian. 3. Vaccinations only raise the pig's level of resistance. If other important management procedures are neglected, even this elevated level of resistance may be inadequate to prevent disease. B. Gilts and sows. 1. Vaccinate sows for parvovirus and leptospirosis at least 2 weeks before breeding and against erysipelas 2 weeks before farrowing. 2. Treat the sows for worms and mange before moving them to the farrowing area. 3. Vaccinate gilts for parvovirus, leptospirosis, and erysipelas at 6 months of age or at least 5 weeks before breeding. C. Boars. 1. Treat boars twice a year for worms and mange and, if needed, trim their tusks. 2. Vaccinate them for parvovirus, leptospirosis, and erysipelas. D. Piglets. 1. At 3 days of age, piglets should receive an iron injection. At 3 to 7 days, they should be vaccinated against transmissible gastroenteritis, TGE. 2. Other management practices that should be considered are teeth clipping, tail docking, ear notching, and castration. 2. Administering medication. A. Injections. 1. Modern health practices require many types of injections. They provide pigs with iron, antibiotics, vaccines, anti-inflammatory drugs, and vitamins. 2. Injection guidelines. A. Sudden animal movement is the leading cause of inaccurate dosage. B. Restrain pigs to ensure that they receive the proper dose at the correct site and to reduce needle breakage. C. Mark treated pigs and keep accurate records to avoid marketing pigs before the proper withdrawal periods have expired. 3. Vaccines. A. Never mix different vaccines in the same syringe. B. Mixing them may save time, but vaccines are formulated to induce a specific immune response when administered according to the label directions. C. Mixing vaccines can inactivate one or both of the vaccines and can cause tissue irritation and abscesses. 4. Antibiotics. A. Do not mix antibiotics in the same syringe before injection. B. Antibiotics are chemical compounds that have unique characteristics. C. Mixing them may cause chemical reactions that inactivate one or both compounds. Subcutaneous, so. Deposits the drug under the skin. Inject only into clean, dry areas. Use the loose flaps of skin in the flank and elbow of small pigs. Use the loose skin behind the ear of sows. Slide needle under the skin away from the site of skin puncture before depositing the compound. Intramuscular, 1 m. Deposits the drug into the muscle. Use a spot on the neck just behind and below the ear. The neck area should be used for 11/1 injections. Damage to the ham can result in condemnation of the meat cut. Use proper needle size to ensure medication is deposited in the muscle. Correct injection techniques. Ensure proper restraint of the animal prior to injection. Ensure proper syringe adjustment. Ensure proper needle placement onto the syringe. Avoid swelling and or abscessation at the injection site. Use properly cleaned needles. Inject only into clean and dry areas. Prevent contamination. Don't use the same needle to inject pigs and remove product from multi-dose vials. Consult with your veterinarian about potential adverse drug and vaccine reactions. Bee sprays. 1. The effectiveness of the spray treatment depends on good restraint to allow complete coverage of the animal. 2. Spraying poses a danger to careless managers who breath the spray or wear contaminated clothing. 3. Mix the product completely prior to spraying to avoid overdosing the pigs. 4. Observe the withdrawal period for each product used. C. Administering medication in feed. 1. Mix feed additives properly to prevent tissue residues. 2. Drug carryover in feeders, bulk bins, feed mixers, and in animal manure may also result in residues. D. Administering medication in water. 1. Large numbers of animals may be treated for a wide variety of bacterial and parasitic diseases quickly, economically, and easily. 2. Treatment via water is more effective than in feed because the animals will continue to drink water after they have stopped eating. 3. Make sure the water has no strong taste or odor after the medication is added. Otherwise, the animals will not drink it. 4. It is difficult to ensure that all animals in a pen receive the correct amount of medication because water consumption varies with pig size, stage of production, and environmental temperature. To reduce the possibility of drug carryover, flush the water lines, tanks, and drinking cups after administering medication in drinking water. Thanks for watching, share, comment, and subscribe for more update.